If your knees hurt when you exercise, you've probably fallen victim to one of two traps. If you've seen a healthcare professional, you were likely told to just stop doing that exercise. Or you're trying to figure this out yourself and it hurts, so you stop, it feels better, you try again, and then it hurts again. A never-ending cycle. Here's the problem. Pain can mean that something is wrong, but pain does not automatically mean that something is being damaged or injured. And completely avoiding movements forever usually keeps people stuck. Pain is knee language, and in this video, I'm going to show you how to decode it. I'm breaking down the exact decision-making tool, a simple flowchart, that I use with every online knee pain client to help them keep training without constantly flaring their knee up while we actually address why it hurts. If you're new here, my name is John Call, and I'm a physical therapist specializing in knee pain and ACL recovery. Through my online coaching platform, ACL RX, I've helped hundreds of active people fully recover and get back to the activities that they love without constantly worrying about their knee. So let's dive in. Let's clear something up first. What pain actually is. Pain is your body's alarm system. It's one way that your knee communicates with you. And just because you feel pain does not automatically mean that something is being injured or damaged. Think about the last time you stubbed your toe. That probably hurt a lot, right? But if we took an X-ray or an MRI of your toe, chances are that there was no structural damage. Now, pain can be associated with tissue injury, especially if your knee pain started after something very specific, a twist, a fall, a pop. That's different, and that should definitely be evaluated. But in the absence of a clear injury, pain is often your knee's way of saying, hey, this is more than what I'm prepared for right now. And here's where people get stuck. They're constantly pushing through the pain, leading to chronic irritation, or they completely avoid pain and then they become deconditioned and fearful. Finding the right balance is the goal. And that's exactly what this system helps you do. Before we go any further, we need to talk about the 0 to 10 pain scale, because this is the language I'm going to use for the rest of the video. A 0 means no pain at all, and a 10 out of 10 is the most intense pain you can imagine, something that would make you stop immediately and seek medical attention. Obviously, 0 is ideal, and a 10 is definitely not where we want to be. Everything in between is where things get more nuanced, and this is where a lot of people get tripped up. First, pain interpretation is relative. A 4 out of 10 for one person might feel like a 6 out of 10 for somebody else, and that's completely normal. Second, whether a certain pain value is appropriate or not depends on the condition, your baseline symptoms, your injury or surgical history, and how your knee typically responds to loading. This is why the middle of this scale is best interpreted with the guidance from a physical therapist who understands your situation. So think of this scale as a tool, not a hard rule. It's a guideline, not the end-all, be-all. Generally speaking, for many knee conditions, pain in the 0 to 4 out of 10 range may be acceptable if it's appropriately managed and it responds well afterwards. And that understanding is critical because everything I'm about to show you in this flowchart is built around using pain intelligently, not fearing it and not ignoring it. Now I'm going to walk you through the exact decision-making process that I teach every one of my online clients so they can make smart, informed decisions when something hurts. Not all pain means stop, but you need rules. Quick disclaimer, this is just general education. This is not individual medical advice, but this can be an incredibly powerful tool if it's used appropriately. So step 1 here is, what's an acceptable amount of pain? And the goal is pretty simple. Your knee should feel okay during exercise and okay after exercise. So how much pain is too much, right? And it depends. But once baseline pain is under control, for many people, I'll allow up to about a 4 out of 10 during exercise, as long as it returns to baseline afterwards. The other piece that most people miss is 24-hour response matters. So if you felt fine during the workout, that's great. But the next day you have more knee pain than usual, you have more joint stiffness or more joint soreness, not muscle soreness, joint soreness, that's your knee's way of telling you it wasn't ready for what you did. So for the sake of this example, let's say yes, right? We have a 5 out of 10 knee pain when we're doing a specific exercise. So let's say yes, my knee does hurt more than the acceptable value given by my physical therapist, right? Step 2, Are you actually ready for this activity, right? If your pain is above what's acceptable, you need to ask yourself two really important questions. The first question you need to ask, am I physically ready to be doing this? This is incredibly important because a lot of people tend to try things that they feel ready for, but in reality, their knee is not physically prepared for it. And this is common after knee injuries and surgeries like ACL reconstruction, where people are told to run, told to jump, told to get off crutches because it's been some arbitrary time since surgery. And because the protocol says so. This is where things break down because everyone recovers a bit differently. And how does a specific time after injury or surgery mean that everyone will be magically ready by then? The answer lies in proper testing. Chase milestones, not calendar dates. Readiness comes from proper testing, not strictly time. If you want a full breakdown of the tests that actually matter after knee injury, an ACL injury, or ACL surgery to minimize the chances of a setback, I'll link that video above and in the description below. The second question you need to ask yourself, did my program logically build on itself to prepare me for the demands of this activity? For example, just because you have the prerequisite strength to run doesn't mean you're actually ready to run yet. Your program needs to build you up to tolerate the forces of running: load, speed, impact, fatigue. Skipping steps is one of the fastest ways to stay stuck. So if the answer to either of these first two questions is no, the flowchart stops here. You need to resolve these programming and physical readiness issues first. Otherwise, pain will likely persist and you'll get stuck in the dreaded cycle of pain, rest, try again, pain. So let's say you can confidently answer yes to these two questions, right? The next question to ask yourself is, does this exercise only hurt in a specific part of the range of motion? For example, if knee extensions hurt in the last 20 degrees of the movement, but it feels fine through the rest, try limiting the range of motion to avoid this painful zone. This alone can be a game changer and lets you keep the exercise instead of deleting it completely, right? So if this does reduce pain to an acceptable level, if you avoid those painful ranges, we follow the flow chart up, then you ask yourself, does my knee hurt more than the acceptable value, right? This would be no. And now we're back at the goal, which is my knee feels well during exercise and after exercise. Now, if this isn't true, if this doesn't help your pain, or maybe it does help your pain, but it doesn't reduce it below the acceptable threshold, move on to the next question, right? If modifying the range of motion doesn't fully solve it, does reducing the weight or adding assistance help? So let's say you did 100 pounds on the leg press and your knee pain climbed to a 5 out of 10. But when you reduce the weight to 90 pounds, your pain reduced to a 3 out of 10. This would be an appropriate modification. Or let's say the bottom position of the leg press still hurt and you use your other leg to assist out of the bottom and this helped. This could be an appropriate way to proceed. So if this didn't fully resolve your symptoms to an acceptable level, right? The next question to ask yourself is volume the problem here? Maybe an exercise feels fine for the first 8 reps, but it hurts at reps 9 and 10 as you approach failure. Stopping the set earlier is a valid strategy. Or maybe you're doing squats, lunges, leg press, all in the same session, which are similar exercises. Removing one exercise or reducing the number of sets can dramatically improve symptoms. Many rehab programs are overloaded with junk volume that make it tough for an irritated tissue to fully recover from. This is a whole other topic in itself. So if you want me to do a video on this, comment the word junk volume below, and I can definitely do a full-fledged video on what this means. So we follow the same rules here. If this does the trick and pain reduces to an appropriate level, great. If not, continue to the last question. So the last question, does changing the movement strategy or swapping for a similar alternative exercise help? So not all squats, lunges, leg presses, deadlifts, so on and so forth, they're not all created equal. There are many ways to coach them to elicit different movement strategies which bias different structures. In this example here, I could be doing a squat, but I can be doing it very differently here, right? I can do more of a hip dominant squat or more of a knee dominant squat. For someone with knee pain, maybe the knee dominant version hurts and the hip dominant version feels better, or vice versa for someone with hip pain. This might just do the trick. If not, you can always attempt swapping the painful exercise out for something similar. Keeping with this example, right? If squatting hurts but the leg press feels fine, this could be a great alternative for now. If all else fails, right? If you tried everything here and you're still not getting your pain down to an acceptable level, or you're not sure, you need to consult with your physical therapist. Remember, this is just an educational guide, not individual medical advice. If you tried all this and still feel stuck, or you're just tired of guessing, working with a knee specialist matters. If you want help figuring out why your knee keeps flaring up and what to do about it, you can book a free call with me using the link in the video description. And if this video helped you, hit like, subscribe, and share it with someone who's stuck in that pain, rest, pain cycle.